The do's and don'ts of managing diverticular disease. Stay away from nuts and seeds, and don't eat popcorn, that's what doctors said. Years ago, if you had diverticulosis, a condition marked by tiny pouches, diverticula, that develop in the lining of the colon. The thinking was that little bits of food could get stuck in those pouches and cause inflammation or infection, which is called diverticulitis. Today, no, the advice was wrong. You don't have to worry about eating nuts, seeds, or popcorn. The evidence does not show a higher risk of diverticulitis in people who eat a lot of those foods compared with people who don't, says gastroenterologist Dr. Lawrence S., a Harvard Medical School professor and the Anton R. Fried, M.D., chair of the Department of Medicine at Newton Wellesley. What else do we know today about coping with diverticular disease? Here are some do's and don'ts. Diverticulosis is common, especially as we get older. It occurs in about 40% to 6% of people by age 60 and typically develops in the lower left side of the large intestine. We think increased pressure in the colon pushes diverticula out through weak spots in the colon wall. Dr. Friedman says, diverticulosis is generally asymptomatic. Won't know you have it unless you have had a colonoscopy or abdominal imaging. In about 5% of people who have diverticulosis, rectal bleeding occurs when a small blood vessel ruptures in a diverticula. This is known as diverticular bleeding. It's not clear what causes it. Bleeding sometimes is triggered by medications like nonsteroidal anti-inflammatories, a common class of pain relievers that includes aspirin, or blood thinners, Dr. Friedman says. Even if you have minor bleeding that stops on its own, call your doctor to get it checked out. If there's a lot of bleeding and you get lightheaded or faint, you should go to the emergency department. You could lose a lot of blood, and you need to find the cause of the bleeding and receive treatment, Dr.